we are having 72 plus viewers. Very good. Then so please do come on Friday evening. PGI question papers in a series, we will kill one after the other, and a good number of them are going to come. And even Monday subject tests also, what we thought is we will pick up the classical questions, 200 questions from classical questions from the other state MD entrance exams like DNB, CET, etc., and have it as a question paper. So you will enjoy with about 50-60 new questions, creative questions. So we will also have a lagatar discussion on Monday evenings also. We have no other work, doctor, let me tell you. Our work is, our dream is, our cry is, until exam is over, your exam only. So that is the reason, don't say, no, we are little alone, or a whole world is preparing for PG entrance, let me tell you. And if you don't find anyone in your proximity, your teacher himself is like a perennial PG preparing aspirant. So that is the reason every हर एक शाम एक लाजवाब शाम होगा अगर आपके साथ बिताए तो. तो yeah, this question, what test you will use for it? SACAT. SACAT होता है न्यूक्लियर मेडिसिन वाला टेस्ट. Selenohomotaurocholic acid test is the one which is used for the cholerogenic diarrhea is what need to be remembered. Acute hepatitis B infection. Yeah. How do you diagnose? Surface antigen एक पॉजिटिव होता है और IgM वाला कोर एंटीबॉडी, कोर एंटीजन नहीं दिखाएगा, कोर एंटीबॉडी is the one which will be positive. One question, doctor, हेपेटाइटिस बी के सेरोलॉजी में कन्वालेसेंट कैरियर का प्रोफाइल क्या होता है, विंडो पीरियड में कैसे डिटेक्ट करेगा, क्रॉनिक कैरियर डिफाइन करने के लिए क्या क्राइटेरिया होता है, पूरा serology of hepatitis B, left and right you must be ready. Tomorrow you have to protect yourself, no? You are a gynecologist, you have a HIV positive, hepatitis B positive pregnant women to operate. So naturally it is a important high yield topic. Then tumor markers, Maharashtra state MD entrance means 2-3 tumor markers jarur aayega. So CA 19-9 is the one. It is not used for screening, but it can be used to at the start of the treatment. As a baseline, you can always use CA 19-9. Elevated AFP is seen in all but not in seminoma. अगर AFP elevate हुआ, वो seminoma, pure seminoma नहीं होगा. उसमें थोड़ा non-seminomatous component is there, is what you have to basically remember. And suppose if you are having a mixed combination, seminoma plus non-seminoma, will you treat like seminoma or non-seminoma? You have to treat like non-seminoma. That is the important principle which you should not forget. Once more, वो सब तो ठीक है सर, ये दोनों के बीच में क्या ट्रीटमेंट फर्क है वो भी बताओ. रेडियोथेरेपी, सेमिनोमा, डिसजर्मिनोमा, हाईली सेंसिटिव. नॉन सेमिनोमेटस ट्यूमर्स को काट के, चीर के, सर्जरी करके, रिट्रोपेरिटोनियल लिम्फ नोड अगर जरूरत पड़े तो निकाल के, पोस्ट ऑपरेटिवली कीमोथेरेपी ऐड करके, there are lot of things to do. If it is non-seminoma, more challenging to treat. But दोनों का है तो you treat like non-seminoma is the oncological property. Now doctor, Henoch Corneal purpura is due to vasculitis but not due to thrombocytopenia. Renal tubular acidosis में hypokalemia is the rule, type 1 and type 2 में. Hyperkalemia कहाँ दिखाएगा is a very very important question. Yeah, just give me the RTA, Liddle syndrome, Gentleman, Barter. Whenever they come in the exam hall, you will remember me. हाँ? तो आपको एक glomerulus है, and here you have juxtaglomerular cells. They are the ones which produce the renin. अगर डायबिटीज हो गया क्या होगा? juxtaglomerular cells become destroyed in diabetic nephropathy. Renin is not produced. That lead to hyporeninemia and that lead to hypoaldosterone. Regular aldosterone का काम क्या होता है? Aldosterone will lead to retention of sodium and loss of K plus and H plus into urine. अगर रेनिन नहीं है, aldosterone नहीं है, जिसको डायबिटिक नेफ्रोपैथी है, क्या हो जाएगा? H plus K plus will not go into urine. Instead, they will be retained in the body. Retention of H plus lead to acidosis. Retention of potassium lead to hyperkalemia. So that is the reason renal tubular acidosis type 4 is also called hyporeninic, hypoaldosteronic, hyperkalemic, normal anion gap metabolic acidosis is the name which is being given, is what you need to basically remember. Magar आप type 1 which is distal, type 2 which is proximal, ये दोनों में hypokalemia दिखाई देगा, is what you have to fundamentally remember, doctor. Yeah. So yes, where is the live class on Friday? Ask K sir. Okay. So Nampally is like our Tora Bora caves for all our gun activity. So please do come. Otherwise you can sit in home, log into NEETPG have 1 Mbps line. Sometimes our video will be freezing. No problem. That time you can go have an omelette or have a coffee. You can enjoy from home, from kitchen you can listen. So that's right. So the same question came even in Maharashtra super specialty exam. Pituitary adenoma, most common type is prolactinoma. How does prolactinoma present? Headache will be there, or visual field defects. If girls, it is detected early because of the amenorrhea, is what you need to remember. Cataplexy is a part of the narcolepsy, where there is a sudden and transient episode of the muscle weakness, is what need to be remembered. Mad cow is prion. We all know that you studied Glasgow coma scale. We don't want to ask. We know that you prepared for Ranson's criteria. We will not ask. We will ask you what is MMSCA. Mini mental status examination. इसमें क्या क्या टेस्ट करते हैं आप? Orientation to time. अब हम किस जमाने में हैं? If patient says we are French have left, Portuguese have left, I think we are going to get independence, then he has no orientation to time. Then orientation to place. Suppose if he says we are in Hyderabad in Andhra Pradesh, he is out, because we are in Hyderabad in Telangana, so orientation to place is out. Then registration, that is repeating the names promptly. ये टेस्ट शुरू करने के पहले पेशेंट को बोलते, मैं आपको 3 बार बोलता हूं, रामू, सोमू और लक्ष्मण, और आप याद रखना. तो after some time in the middle of the test you will ask, do you know what 3 names that I told? So he forgets. So like that you will basically calculate. Recall, language, repetition, complex commands, etc., etc. Based on that you will give a score. Maximum score is about 30. Anything above 27 up to 30 is good, is what you need to remember. The whole challenge क्या होता है? आप MD फाइनल ईयर एग्जाम गए तो MMSC लिखना है केस शीट में, न्यूरोलॉजी केस प्रेजेंटेशन में. So will you do all this and you have given 10 minutes to completely examine the patient, including genital examination, inguinal hernias, everything in the patient. अगर है क्या वो बोल के, तो what you will do? Before only you will write all this. आपका पीजी से रहता है ना डॉक्टर, सेकेंड ईयर पीजी फर्स्ट ईयर, वो ऑर्गेनाइज करता है ना टेस्ट को. एक शीट जो एग्जामिनर को देना है वो शीट रात ही लिख के बैठ जाते और एक बार बोलते, मैं आपको एग्जामिन कर रहा हूं, मालूम है क्या? मालूम है डॉक्टर, फिनिश 30 द स्कोर, ओनली 1 क्वेश्चन यू विल आस्क एंड गो अहेड. अगर आपका किस्मत अच्छा नहीं है तो कैसे केस आएगा आपको एमडी फाइनल ईयर में, जनरल मेडिसिन एमडी फाइनल ईयर में, A patient with pharyngeal, laryngeal paralysis with Broca's vernix combined together will come. And examiner will ask, forget about the physical findings, first tell me about the history. How will you take history from a complete aphasic individual? So that is called kismet of passing MD. So still examiner will pass you, don't forget. But suppose if you give a very complete bolus history, then he will fail you. Because aphasic patient mein how you elicited history is his contention. Then what is absent seizure mein kya dikhayega? 3 Hz spikes and waves are the classical feature. Predosum kiske liye dete? Scorpion bite ke liye. Identify which is scorpion in this. Bas, then you will get the answer. Not all the people born in November. Mesobutus tamulus. Recently in APPG there was a question, एक lizard का, what question it was? एक lizard का नाम क्या है? Zoological, what is it? Gilamar monster. So what is it? Is it lizard or frog? Then so giving predosine, even still practiced in the modern practice. Why? Scorpion poison is known to release boluses of catecholamines. So that is the reason we give to antagonize the action of the catecholamines on the alpha receptors, which lead to severe vasoconstriction and hypertensive crisis. We give the prazosin is what need to be remembered. Mongolian spots are commonly seen on presacral area. Oh, this is a beautiful question, doctor. Same question comes in the tomorrow's exam. None of your classmates who didn't take this mock test will not be answering it. I can challenge it. Right? So, iska secret kya hai? Basically, symptomatic hypoglycemia hai ek neonate mein. How much of dextrose you have to give in milligram per kg per day to the child? Basically, when you need to treat hypoglycemia in a neonate or a newborn, once it is below 40 or 50. Usual bolus is 2 ml per kg of 10% dextrose solution given intravenously, bolus, loading dose, followed by you need to put an infusion rate of 6 to 8 mg per kg per minute. 3 kgs का बच्चा लड़का है, baby है. So 8 mg per kg per minute is what you have to basically administer. इसमें challenge क्या है कि first part is being given as ml per kg because it's the bolus. Second is given as an infusion, hence it is given as mg per kg per minute. So how to basically calculate? इसके लिए एक simple formula होता है. अगर आप dextrose 10% इस्तेमाल कर रहे हैं तो then the infusion rate is given as 4.2 into body weight. Body weight 3 kgs है, 3 kgs. 3 into 4.2 कितना होता है? 3 4 is 12, 3 2 is 6, 12.5. So it will be around 12.5 ml per hour you have to give. एक दिन में कितने घंटे होते? 24 hours. So 24 into 12.5 कितना हो गया? 300 ml you have to give in day. किसको दे रहे हैं आप? 3 kgs बच्चे को. तो पर kg कितना हो गया? 300 by 3 हो गया. 100 cc per kg per day is what you have ultimately given. Symptomatic, no? In symptomatic, we are supposed to give usual bolus is 2 ml per kg, no? No? 5 ml of dextrose कितना percentage का? 5 ml is there? Oh, then we should make it asymptomatic then. Oh, sorry. Yeah, missing. It should be asymptomatic. Good correction. Good correction. Okay. So then we will make it asymptomatic, baby. All right. accepted. Now, iron, but this question, if given straight in exam tomorrow, you must know symptomatic hai to 5 ml per kg or asymptomatic hai to 2 ml per kg, but remaining things are same. Remaining things are more or less same. Huh? Then, when will reti count will increase is a important question. It is around 4 to 7 days after initiation. Typically, it will increase is what you need to basically remember. What is the best method to transport? Favorite question. Maharashtra, Bombay airport to Sydney airport in Australia. So, Kangaroo Mother Care is what you should not forget. Repeated question. Once more आएगा ये. Transport incubator, best for transport of newborn with maintenance of warm temperature. Incubator को power कहाँ से? Battery से. Battery काम नहीं करे तो. Mother's warm hug is more warmer and more persistent, consistent. Transport incubator according to the NRC protocol. I'll check that. I mean, I didn't get time to do that. Maybe, as our doctors rightly says, NRC protocol के हिसाब से. Then, 1 to 13 years of age, what is the best way? 1 to 13 years, hand and wrist, 3 to 9 months, shoulder, and 12 to 14 years, elbow and hip is what you have to basically remember. Cloudy cornea is not seen in hunter. Hunter को cloud है तो hunt कैसे करेगा? नहीं करेगा. Hunter का what type of inheritance pattern? X-linked. किसको hunt करते हैं? Anybody? Opposite sex को, which is X-linked. Hence, hunter is X-linked basically. All hunting ultimately in evolution was for the X-linked only. Then, what is rumination disorder? Rumination disorder is not gastroesophageal reflux. Rumination disorder में क्या होता है बोले तो, लड़का खाना खाएगा. All that food keep on coming into his mouth and he will be swallowing it back. Once more it keeps on coming into mouth, he will be swallowing back. It's more behavioral. It's more behavioral rather than any organic problem in the gut. So it is found in about 3 to 4% population, but lot of people don't tell. And why they keep on bringing it into mouth and then swallow, mouth and swallow? They don't have nausea. They don't have abdominal pain. They don't have that litmus taste like in gastroesophageal reflux. It is the undigested food. Once more they feel that they are eating it back. That is the rumination disorder. It is found in case of infants and it is also found in the teenagers and adolescents. Teenagers and adolescents. The point is, in the childhood our breathing is thoracic. When you keep growing adulthood, it becomes abdominal. Right? Thoraco-abdominal. So, a good practice of abdominal breathing is required. So, thoda khane ke baad immediately abdominal muscles get stimulated in them. And typically they don't practice abdominal breathing, they use thorax. That intrathoracic pressure will keep bringing it out. And it is not voluntary. It is not, they want to bring it out like Shivalingam. They don't do that. Right. So, that automatically keeps coming out. If it is done voluntarily, that becomes bulimia nervosa. Bulimia nervosa में they are worried about their body shape. थोड़ा pizza खाने के बाद they feel that they are bloated like Japanese sumo. Nobody will bloat, but psychologically if you feel you are bloated, what will you do? You will run to the, I was telling you that pizza I don't want, I am bringing down the weight, and they will run to the bathroom and vomit it out intentionally. So that's the point. So it appears 3 to 5 is wrong. Commonly it appears in infants and very prevalent in adolescents. That's a common age group. Undigested food, no nausea. Agar nausea hai to it is not the diagnosis. Adenoid is basically trisomy 18. Mycobacterium leprae divide in how many days? 11 to 13 days. Very cynical question. But this is a question whose answer is known to 70% of serious aspirants. Serious PG aspirants ऐसे चीजों को छोड़ेगा नहीं क्योंकि ये repeatedly asked question है leprosy में. Generation time of lepra bacillus, generation time of TB bacillus, right? So such questions you should not do mistake. Measles ka incubation period, they are not the numerics meant for living, they are the numerics meant for ruminating, is what you need to be very sure about. Max Joseph space कहाँ होता है? अगर lichen planus हो गया तो you will find parakeratosis, thickening of stratum granulosum, sewage bodies, severoid bodies, and liquefactive degeneration of the stratum basale will be there, and that typically will lead to development of a separation of the underlying lamina propria and create a space which is called as Max Joseph space in lichen planus, is what you need to remember. Denny Morgan's folds, where will you find? Typically wherever atopic dermatitis is there, if you look at around the eye, there will be Dennis Morgan's folds in the people with atopic dermatitis. Auspich sign is psoriasis. Who doesn't know? Then endotidal CO2. If it got increased, what are the causes? Hyperthyroidism, shivering, malignant hyperthermia, anything can be responsible. Avoiding awareness of pain, of reality, by negating the sensory data in which is basically which type of defense mechanism. It is basically called as denial. Denial. So suppose you got 2000 rank. The rank is printed on the result sheet. You will believe that notification only didn't come. I did not see. Who said I wrote the exam? That day I was out. I did not. I forgot and I slept. So when I did not write, where is the question of getting result? Too much, no? So that is called denial. Then displacement is what? इसके ऊपर गुस्सा उसके ऊपर निकालना होता है displacement. That's what if chief is angry in morning rounds, the cause is not you, it is chief's wife who did not feed him proper breakfast. Then distortion क्या होता है? It is the reshaping of the external reality to suit to one's own needs is basically called the distortion is what need to be basically for example, a singer has sung, she received acidic comments, ये सूरदास है या बेसुरदास की प्रोग्राम किसमें गा रहे बोल के यहां आ गए बोल के बोला जज ने, तो वो क्या रिमेंबर करेगा? वो बेसुरदास में बोला क्या, सूरदास में क्यों आया बोला? तो I thought he complimented only, did he criticize? That becomes distortion. Then blocking we all do, right? So inhibition of thinking, right? Then isolation, separation of an idea from the emotion that accompanies it. You go to any of your patient who is a serial killer, will he be depressed like you or will he be anxious like you? No, doctor. He says it's a normal phenomenon. At least every year 5-6 people should be butchered and killed. Where is the regret about it? So isolation of the idea from emotion. Even we also will become like that, no? Second year, third year आ गया, intubation किया, patient मर गए. Oh, I tried my best, but he died. I don't know what happened. So that's what you will tell and come out. You first year में बहुत sensitivity रहता है. Then dissociation is temporary but a drastic modification of a person's personal identity. They will forget everybody and then go walking. Fugue reaction. So I leave the literature for you. Then but defense mechanisms is a favorite area in psychiatry. Schizophrenia, electroconvulsive therapy, depression, mania, antipsychotics, antidepressants. Pura 15-20 topics. You must be ready to ruminate. Then what percentage of mortality? This is purely to tell you that exam is negative marking based exam. You still tried this. In spite of our repeatedly telling, don't do that. You need to recheck your tendency. That anxiety that comes unless we click on the answer. All the tendency पर overcome होना. Negative exam नहीं है तो कुछ भी कर सकते हैं आप. रंगोली करके आ सकते एग्जाम में. अभी ये नेगेटिव मार्किंग में मुझे मालूम है कहीं सुनाई दे रहा है वो 20% है. Suddenly you go into the tendency, unacceptable. It is 30% unfortunately. If you do another study, it will be 50%. Then indication for thoracotomy. This is a definite question, doctor. More than 1.5 liters of blood loss हो गया. Thoracotomy should be done. Continuing blood loss more than 200 ml per hour हो रहा है आपका intercostal drainage tube से. Thoracotomy के लिए indication है. Then cardiac tamponade, which is an emergency, which you need to relieve. Persistent air leak or retained foreign body more than 1.5 centimeter in diameter, they are all the indications. What is the criteria for emergency admission into a burns unit is a very important question. Any inhalational injury or you need to do fluid resuscitation, wherever you need to do eschorotomy or any surgery, or if hands, face, feet or perineum is involved in burns, indication for criteria for acute admission in burns unit is what you have to be very sure about. Similarly, there are other things also which come under the criteria. So, cleft lip, cleft palate. PGI aims every exam में एक lip or palate will be definitely tested. So, doctor 3 to 6 months will be lip. Lip में 3 letters होता है, 3 होता है, 3. So, that's the point. Then 6 to 18 months होता है, palate is what you need to remember emphatically. Head and neck, worst prognosis. Adenoid cystic carcinoma is the one which infiltrate the nerves. It has got the worst prognosis is what you need to remember. Chylothorax, what is the most common cause in case of children? It is the post-surgery, not trauma. Post-surgery is the most underlying cause is what you need to remember. Most common site of lymphangiosarcoma is post-mastectomy. The lymphedema becoming sarcomatous in the limb, upper limb. What defines morbid obesity? Once more, numerical exam will be Maharashtra state entrance. So, it is also asked in 2006 Maharashtra. So, very important, highly likelihood question to come, more than 40 is considered to be the BMI. Hilum is most common location for all splenicular. And hemangioma is the most primary tumor of the spleen. And the most common cause of neoplastic enlargement, another way of asking question. Then lymphoma become the answer. समझ गए ना? ये दोनों में फर्क है. मोस्ट कॉमन बिनाइन ट्यूमर होता है हेमांजियोमा. अगर कुछ ट्यूमर होके एनलार्ज हो गया, which tumor is responsible means then the answer become lymphoma is what need to be remembered. Delorme's operation is for rectal prolapse is what you need to basically remember. You will be basically suturing the rectum to the surrounding tissues using the Delorme's incision करके suture करते. So Delorme's procedure. Charles Phillips procedure. So last time we used Maharashtra 2012 questions. उसमें भी gills amputation, cisterns operation. So acronymous names operations is all about very important area for them. So doctor, if adhesions are forming post-operatively causing recurrent small bowel obstruction, then we do what is called Charles Phillips transmesenteric plication surgery, it is called as. Similarly, intestinal intubation, you can also put a tube and inflate it and prevent adhesions from forming in the gut. So that is another way. Repeated adhesional lysis you can do. There are the various options which are available. Then ulcerative colitis में toxic megacolon बोलने के लिए कितना centimeters होना है डॉक्टर? 6 centimeters is what you have to basically remember. Toxic megacolon. Colonic angiodysplasia are very common source of the bleeding. Elderly man में एनीमिया हो गया, ट्रांसफ्यूशन दिया और एक बार एनीमिया सडनली हो गया, फिर भी आपके माइंड में एंजियोडिस्प्लेसिया नहीं आया, कोलोनोस्कोपी नहीं किया, फिर ब्लड दे रहे, फाइनली old man will die because of either hemosiderosis due to repeated transfusions or due to some infection like hepatitis C will come and kill him. So be sure, common sense first, Bailey and Love next. Then ascending colon, most common site, and also cecum, because their wide diameter will create intraluminal pressure to become high, and that high intraluminal pressure will predispose to diverticulae, angiodysplasia and all these other pathologies. Most common location for solitary rectal ulcer kahan hota hai? Solitary rectal ulcer is more common in the anterior wall of the rectum, and you should always differentiate any rectal ulcer from rectal carcinoma, inflammatory bowel disease, Crohn's disease, etc. is what need to be remembered. So what is the other name? Proctalgia fugax. It is more common in the entrance preparing medical students who sit for long hours in the reading room without getting up. So be sure to get up in the middle, play little table tennis and then come back and read because you need to have little sport also. Spigelian hernia. What is it basically? Typically it is a hernia occurring at the level of arcuate line, and it is typically an interparietal hernia is what you need to remember. Adrenal adenoma को remove करने के लिए what is the size criteria is a very important question. Any size more than 4 to 6 centimeters, any soft tissue calcification on the CT, or if the CT is showing more than 10 Hounsfield units or irregular margin of tumor inhomogeneity, they are all the criteria. Similarly, what are the criteria for removing adrenal glands is also another. If incidentaloma is being found in the adrenal, then what is the criteria for removing the adrenal? There are also criteria for that. Renal TB may. Typically, anybody answer painless hematuria? So these are the standard questions for which examiner wants simple standard answers. The way you will tell, you will put up in a shadi.com, I am a simple human, I want a simple girl as a wife. If you are interested, please call to the following number. So like that, examiner says simple answers दे दो. तो यहाँ भी आपका imaginative skills का इस्तेमाल कर रहे हैं तो इस जमाने में नहीं आएगा सीट. तो increase urinary frequency. Posterior urethral valve कहाँ होता है? It is distal to the verumontanum. But first of all, what is verumontanum is an important question. So basically, you have got a landmark for the prostatic urethra. It will create a bump like a mountain ridge called verumontanum, and most common type is basically the one which is distal is what you need to remember. Peyronie's disease basically is what, doctor? During erection, due to the fibrous plot, there is a bowing of the penis for which circumcision need to be done, is the one which is a very repeatedly asked MCQ in other exams. It's also called induratio penisplastica. Now doctor, testicular teratoma hai. How will you basically treat? Basically orchidectomy with retroperitoneal lymph node dissection is what you need to do. A standard protocol. Post-operatively chemotherapy bhi dete. Then of course once more stage 1 tumors hai to kya karna and other things. I leave the literature for you to review. Tension band wiring kahan lagate? Tension band wiring is used in specific scenarios where the tensile strength is converted to compressive force and promote the wound fracture healing. So any avulsion fractures, osteoporotic bone etc. patella, olecranon, medial malleolar fracture, tension band wiring का इस्तेमाल करते. Hill Sachs is what? Bankert is what? Bankert is anteroinferior defect which is bony. Hill Sachs होता है posterolateral defect, which is a defect found in the humeral head whenever there is a dislocation of the shoulder, is what need to be remembered. All differences between intracapsular and extracapsular fracture of the humerus is a very important, femur is very important question, doctor. If it is an intracapsular fracture neck of femur, It will jeopardize the circulation that comes to the retinacular vessels, etc. So, this intracapsular fracture neck of femur is highly vulnerable for a vascular necrosis is what you need to remember. Other differences also you should read. Malunion kahan hota, non-union kahan hota. Jahan bhi avascularity hota, non-union hota. Jahan bhi malalignment hota, malunion hota. So, that's a common principle. Now, congenital knee dislocation kaise hota? It happens in hyperextension of the knee joint. Primary osteoarthritis mein, what is the main deformity that you see most commonly? It is the genu varus, and similarly it is the hip osteoarthritis. Then flexion, adduction, external rotation of the hip is the consequence of the osteoarthritic injury, is what you have to basically understand. Now doctor, ankle ka sprain ho gaya, then anterotalofibular component of the lateral collateral ligament is the one which is most commonly injured. These are all very standard questions. No amount of mercy is showered by the competitors, not by examiner, competitors if you didn't answer. Because they left all parties, they left all boyfriends, girlfriends, sat and read. Why you should get the seat if you didn't answer? That's their contention. So doctor, don't leave your relations, but read the facts. These questions, this paper, today's paper, 160 you should cross, and you check the topper. Topper will be there among our crowd. He will cross 180 comfortably, right? So because this is the most standard paper, right? So which is true about giant cell tumor? Maharashtra state entrance is on Jan first week. Actual paper will come out. That also we will use it like a mock test. Okay. So ये सब अभी discuss कर रहे हैं ना, but actually it is 300 marks. I will convert it into 200 for you, and then we will take that. You see how you are scoring. If you are scoring 150 plus in that actual exam paper which is going to happen in the January first week, it is an acid test that you crossed. Okay, still a lot of time is there, 2 weeks more. Giant cell tumor, typically it is the lower end of the radius located in the epiphysis, and commonly the bones around the knee joint is what you need to basically remember about giant cell tumor. So bubble appearance, no calcification, no reactive sclerosis, everything on giant cell tumor. This is an easy question. A should be answered, sorry. Key mistake, a mistake. Huh? Any other mistakes earlier in the key? No? Huh. Sequestrum is, actually sequestrum should be there, is what? It is basically a piece of dead bone surrounded by infected tissue becomes sequestrum. And involucrum is that dense sclerotic bone overlying the sequestrum become the involucrum, is what you need to understand. So what is the visible spectra, doctor? 400 to 700 nanometers, and anything longer than 760 become infra, and anything shorter than 380 become ultra, is what need to be remembered. Anterior surface of the cornea कितना mm? Last time क्या पूछा Maharashtra state entrance में? Where will medial rectus will go and insert how many centimeters? इसके पहले कितने distance of limbus के पीछे होता है? What was uveal tract? Ciliary body. हाँ. So doctor, these few numericals of eye you should not forget. So it is 7.8 mm is the radius of curvature. What is the dioptric power of the lens, doctor? Around 60, 59 diopters. Then refractive index also you should remember, point to point for the exam. Huh? Now, Moraxella lacunata is angular conjunctivitis. To avoid amblyopia, what is the ideal period to repair the congenital cataract? Around 6 weeks? Huh? As early as possible. In this, as early as 6 weeks. Oh, okay. Right. Rosette shaped cataract is basically trauma. Keradic precipitates are seen in Today's exam is just a cakewalk. C-fan retinopathy is basically sickle cell disease. And C-fan retinopathy may, what happens? Neovascularization will be there whenever sickle cell vaso-occlusive episode is there. Hypoxia will be there that induces neovascularization, and that lead to development of C-fan appearance, which is stage 3 is what you need to remember. The latent squint, एक strabismus का question जरूर आएगा. So what is that basically called, doctor? Is also called heterophoria. So it is the tendency to malalignment of visual axis which is corrected by fusion capacity of our retina. Every day God has to produce so many skulls. वर्ल्ड वाइड प्रोडक्शन हो रहा है ना डॉक्टर, तो थोड़ा इधर उधर 1 सेंटीमीटर मिलीमीटर फर्क हो गया तो ये आंख एल्डर सिस्टर को देखेगा और ये आंख से आप यंगर सिस्टर को देखेगा, थोड़ा हो जाता. देन आप कुबुल है बोले तो किसको कुबुल बोला, टेंशन हो जाता. तो इसलिए रेटिना लेवल में फ्यूजन हो जाता, इसको बोलते हैं हेटेरोफोरिया. देन एंटी ग्लाकोमा ड्रग that is long acting and used once daily would be timolol. Long acting is available, which will use one anti-glaucoma drug. Definitely question will come. Long acting solution of timolol is available. Excimer is used in LASIK. Then noise induced hearing किस frequency पे होता, ototoxicity किस frequency पे होता, you must be very sure. Noise induced hearing loss 2000 to 4000 hertz, doctor. Drug-induced toxicity is between 4000 to 5000 hertz. Once more, these values will come back in exam. What is Luke's abscess, Citalese abscess, then Bezold's abscess, mastoiditis में, you must be sure. Luke's होता along the posterior wall of the external auditory canal. Bezold is medial aspect of the mastoid tip up to the sheath of the sternocleidomastoid, the way the gravitation of the pus happen. Then Citalese is along the posterior belly of the digastric, and you also have a post-auricular abscess. In which case, though it is not malignant, you need to do biopsy and rule out possibility of malignancy. In the case of the rhinitis caseosa, also called nasal cholesteatoma, is the place where, though it is not pre-malignant, you need to do biopsy to rule out, is what need to be remembered. Mucocele commonly is in frontal sinus, and if you take the cricothyroid, it is the only intrinsic muscle which is outside the laryngeal framework, is what need to be remembered, and it is the only muscle which is supplied by external laryngeal nerve, and it controls the pitch, and which get injured in thyroid surgery. External laryngeal nerve and pitch is affected in thyroid surgery. That's what 3-4 mock test में सब questions को मिलाए तो सारांश. Then abortus in uterus with a dilated open os. All abortions में os open, os closed. That is what you have to remember, doctor, very clearly. Threatened abortion is a os closed abortion. Inhibited abortion is open os. Then incomplete abortion also open os. Complete abortion is a closed os. Missed abortion is a closed os. Okay, doctor? And remaining part of definitions आप एक बार देख लेना. Then HIV transmission is maximum during the vaginal delivery out of all. So it is about 75% of cases during delivery, interpartum, and 30% transplacental and 10% during breastfeeding. Out of overall 25 to 35% of the perinatal transmission if untreated. That's the reason we need to treat. Interspinous diameter, fetal skull, maternal pelvis, like a tailor stitching the wedding gown. You must be ready with all measurements before you go to exam hall, doctor. So it is typically 10 centimeters. Obstacle conjugate is normally more than 10 centimeters. Interspinous is between two ischial spines, which is the smallest diameter of the pelvis. And negotiation through that is all about engagement. Zero station is what you need to be quite sure. And it corresponds to the transverse diameter of the mid pelvis is what need to be remembered. What is the longest fetal skull diameter? This you know very well. Mentovertical is 14.5, submentovertical is 11.5, but mentovertical was not given. Submentovertical iska chela to aa gaya na. Submentovertical is 11.5. You only prepared mentovertical and did not find in exam hall and like a lost Nemo in the sea. You can't be like that. Exam means what, doctor? Obstetrics gynecology means you should be merciless killer. 30 out of 30 काट के चीर के आना, उस पे कंफ्यूजन है, मैंने वो सोचा, ये भी हो गया, ये भी होता है क्या? नहीं नहीं नहीं, we don't accept all that, right? तो मेडिसिन में आप बोल सकते, हम सुन सकते. First to pubis compression is most likely to occur at which level? Submentobrachmatic diameter के level पे face to pubes compression basically will happen. It is the point where the chin joins the neck to the center of the bregma is what need to be remembered. Then lowermost portion अगर ischial spines के level पे है तो station क्या होता? न्यू दिल्ली होता, ऑल इंडिया इंस्टीट्यूट होता. उसके ऊपर माइनस बोले तो चंडीगढ़ पीजीआई, नीचे आ गए तो any other medical college, zero. Then entrapped breech, what is the surgery which is available? Basically Durson's operation, 3 surgical incisions on incompletely dilated cervix is the way to affect the delivery of the fetus. What defines fetal tachycardia? Basically normal fetal heart rate कितना होता है डॉक्टर? 120 to 160. More than 160 tachy हो जाता है, less than 110 become brady हो जाता है. Don't expect 50-60 to happen. Then according to ACOG criteria, favorite question of examiner, doctor, if you do this wrong means we should get serious on gynops. So this is one table. 100 grams OGTT लिया, 1 hour more than 180, 2 hours more than 155, 3 hours more than 140, declared diabetes. 100 grams लिए तो 75 grams OGTT लिया, then 2 hours more than 140 is abnormal. So that is what you have to basically look for. Then how much beta HCG पे आप gestational ring को uterus के बाहर देख के ectopic pregnancy बोल सकते. So it is around 1500 units is on transvaginal sonogram. Once the beta HCG reaches 1500, you are supposed to look at the gestational ring inside the uterine cavity is what need to be remembered. Then uterine height more than the gestational age. What is the common cause, doctor? And she also has vomiting, pervaginal bleeding, etc. The disproportionate enlargement is a feature of hydatiform molar pregnancy is what need to be remembered. Conjoined twins hai. What is the most common type? Chest or chest. Sine is sine. Thoracopagus is pagus is most common is what need to be remembered. And if this kind of list is there, don't forget to look at the list also. कभी-कभी examiner antonym synonyms इधर उधर करेगा. Intrauterine death most likely results in DIC leading to exhaustion of fibrin leading to hypofibronegenemia. Obstetrics में most common association with renal failure किसके वजह से होता है? Typically, renal failure is often associated with severe preeclampsia to eclampsia में urea creatinine will shoot up and PIH is more often a underlying cause. Self breast examination by females, you have to advise when, most optimum time, typically between 7 to 10 days after the start of the menstrual period is the right time for standing before mirror and inclining forward to look for any mass lesions in the breast is what you have to basically advise. During pregnancy most common degeneration होता है red, otherwise most common होता है hyaline degeneration. Then some other most commons don't forget. Cystic degeneration especially happens in interstitial fibroids. Fatty degeneration typically is found after menopause, and calcific degeneration more common in subserous fibroids. These are some special adjectives, match the adjectives. Colposcopy and Pepinicolau smear and CIN is one of the favorite area of the examiner doctor. So what are the indications for colposcopy? Any suspicious looking cervix, CIN 2 or 3 on cytology, and any persisting abnormalities on cytology, then any unsatisfactory quality, or if you are unable to look at the squamocolumnar junction at the time of colposcopy, that become indication for repeated colposcopy. In cervical tear repair, where will you put the first stitch? Typically above the angle, above the apex of the laceration, to control the bleeding of the vessels that have been retracted, you need to basically do fundamental techniques of the labor room posting. Then strawberry cervix is classical of trichomonas vaginitis, where you have got multiple punctate hemorrhagic lesions resembling the strawberry is what need to be remembered.